This is Brent of the Brookbush Institute, and in this video we're going to do femoral nerve neurodynamic testing. I'm going to have my friend Yvette come out. She's going to help me demonstrate. Now keep in mind, if I'm doing these femoral nerve neurodynamic tests, Yvette's already given me reason to think that the femoral nerve may be involved in her subjective examination. So think about neurogenic symptoms, things like tingling, numbness, that sharp shooting pain that happens when nerves get really inflamed, like some of you guys who have had sciatica, you can think in that direction. Think about paresthesia, the pins and needles. And generally people with femoral nerve issues have had lumbar pathology in their history or currently have lumbar pathology. Keep that stuff in mind, because this test actually looks exactly like Eli's test. If any of you guys know Eli's test for rectus femoris extensibility, these tests are identical with one big difference. As I'm doing the prone knee bend or knockless femoral nerve test, what I'm looking for now is, hey Yvette, how does this feel?
Fine.
I'm looking for her concordant symptoms that were perhaps more neurogenic in description, right? So does this bring on any of that tingling in your thigh you were talking about?
No.
No? Does this bring on any back pain?
No.
No? So you got no lumbar pain, no tingling.
No.
All right, so we can get a little bit more provocative by adding a little extension now. All right, so now we'll go with as much knee bend as I can get. I'm still going to use this hand to stabilize her pelvis because I don't want to push her into lumbar extension. I don't want this to become a lumbar extension test. I still want to test just lengthening of the femoral nerve. So now I'm going to do this. Hey, how does that feel?
Fine.
Still fine. So this would be a very negative test, obviously, but notice while I was going through this, guys, I wasn't just looking at knee flexion restriction. I wasn't just looking at hip extension restriction. I'm not just testing the rectus femoris. I'm trying to see if I increase tension in the femoral nerve by stretching it, do I bring on concordant signs related to her pathology, the symptoms she was complaining of, as I go through these motions. Now, there's a couple other things we can think about as we do this test. That was the basic test. I want you guys to get good at that test, understand that test. That test you should probably have memorized. But we can start differentiating a little bit here. So if I just, for example, did both legs, compared sides, and happen to notice that her opposite leg, let's say she came in with left-sided low back pain, and her right leg brought on left low back symptoms. That's the crossed femoral nerve test, and it usually indicates more discogenic issues, maybe an HMP. Okay, so that's very similar to if you guys saw the straight leg raise test or the slump test, same thing there. If the opposite leg brings on symptoms, you know you probably have some disc stuff going on, and you guys can kind of think in your head from an anatomy perspective, you probably have to have a pretty significant disc issue that stretching the opposite side nerve affects this enough to bring on pain on the opposite side of the back. Now we can do a little differentiation too if you guys wanted to get a little fancier and start thinking about, well, what nerve roots are involved and potentially how could I treat out some of this neural restriction. You guys can make this a lateral femoral cutaneous nerve test by doing the same motions but adding a little adduction at the hip. So now I'm bringing her knee towards her other knee. All right, so that might give me a little indication of what nerve roots involved, or maybe I want to do some different release techniques to try to help increase mobility in that tract. The other thing we can do is a saphenous nerve test. This is a little different but same position, where I'm going to go into dorsiflexion and eversion at the ankle, total extension of the knee, and then I'm going to externally rotate at the hip and abduct. All right, so that's a saphenous nerve test. All right, so we did the knockless prone knee bend. We talked about the opposite side, right? So that's the cross femoral nerve stretch being a sign of discogenic issues. We talked about sensitizing this a little bit for the lateral femoral cutaneous and saphenous nerves, and you guys can get fancy with that. The other thing that you probably want to be aware of is you can do this same test, sometimes called the femoral nerve traction test, in side bend, or side lying. So I'm going to have Yvette go ahead and lie on her side, face the camera. This comes in handy, and I'll tell you guys why. Some people, especially with lumbar pathology, don't tolerate lying on their belly like that. You won't be able to get the test done. They'll lie down, they'll be in pain, you'll start flaring them up, and then that's just uncomfortable for both of you. If I bend this knee to kind of keep her nice and stable, I can use this hand, right, to kind of stabilize her pelvis. I can then bring this leg back and just twist right around this way, right? So now I'm bringing her into hip extension and knee flexion, right? And I'm following the same path of logic. As I increase tension, I'm looking at Yvette's face. I'm asking her, hey, does this bring on any of those symptoms that you were talking about? No? Good. Right? And some of you guys are already thinking, much like with the prone test, wow, that looks a little like Ober's test. It does. So think about your use cases. If I was just doing Ober's test, chances are I'm just looking for mobility issues, right? Ober's test is a TFL extensibility test. If I'm doing this for the femoral nerve, again, I'm looking for those neurogenic signs, right? Like, does this bring on tingling or burning in her quad, right? Does this bring on her low back pain, right? And again, we could even do this on both sides and do that crossed femoral nerve thing, right? So there you guys have it. You have the prone knee bend, you have the sideline, you have the crossed thing, which is an HMP sign, and of course, you can start differentiating a little bit with the femoral lateral cutaneous, adding adduction, and then you can do the saphenous nerve in prone. The big things to keep in mind is you stretch the femoral nerve with hip extension and knee flexion, and this is a great test for you to start wrapping your head around this idea of predictive values in special tests. So if you use this test with individuals who have lumbar pathology and the right symptoms that they're complaining about, they're great tests. If you just use these on everybody who walks into your clinic, regardless of what symptoms they're complaining about, then I'm telling you right now, these tests are gonna lose some of their sensitivity and specificity because your predictive values go way down when there's no neurogenic signs to latch onto. For those of you guys who are students, again, this is one of those tests where I would put it on your list of things you want to see in clinic. That's what your clinical affils are for. You guys are going to do this to each other in class, and you're not going to feel anything. It's going to feel exactly like the Eli's test or exactly like the Ober's test. And that first person you get who has femoral nerve stuff, if you're this aggressive with them, I can tell you right now you're going to send them out the door as fast as you possibly can. And then number two, of course, it is going to feel very different on a nerve patient, right? Someone with nerve involvement, than it is going to feel just muscular tightness. Those things are not quite the same. If you guys have any questions on those things, please go ahead and leave them in the comments box below. I hope you guys enjoyed this video.